How do they
It's
get
not a
that?
spirometer. A spirometer is a machine that usually sits on the desktop that's connected by tubing that you wrap your lips around. It's not giving any treatment.
Okay.
It's just measuring flow. Now, it's something that takes at least minutes to perform. So you're not going to be connected, particularly if you're in any type of extremis. In fact, you can't do pulmonary function test on someone who is not comfortable or someone who's in any type of distress. You can't perform pulmonary function test. Yeah. So I'm not sure what you're referring to, but it wouldn't be a spirometer.
Okay.
Now, typically what you have to do, by the way, is the patient has to acclimate to this device. So you don't immediately measure tidal volume. It's like if you ever gone skin diving, where you wear one of those snorkels. Okay, when you first put the snorkel on and go beneath the surface, it takes a little while to get acclimated to it. Now, once you've been doing it for about 10 or 15 minutes, then all of a sudden, you're breathing more naturally. Okay, but when you first use that snorkel, it doesn't feel natural, you're not breathing normally. Same thing occurs with pulmonary function test. You connect the patient up, and then you wait a few minutes before you actually start taking those measurements of tidal volume, because in the beginning, the patient is not yet acclimated to the machine. Okay. By the way, let me just mention this measurement called minute ventilation. Minute ventilation is the amount of air that moves into and out of the lungs over the course of a minute. So the way you measure minute ventilation is to multiply tidal volume, the amount that moves in and out during a single breath. You multiply that times respiratory rate. Okay. So that if the tidal volume is 0.6 liters, let's say, and the respiratory rate is 20 breaths per minute, or 20 respirations per minute. Okay. Then minute ventilation is going to be 12 liters. You simply multiply liters times respiratory rate. When we say that a patient, and I'm going to go on just a little bit further before we come back to pulmonary function test. If we say that a patient is hypoventilating, we mean that they have a decreased minute ventilation. Either their respiratory rate is low, abnormally low, or their tidal volume is abnormally low. Let's say that normal respiratory rate is 12 to 16 respirations per minute. Okay? And someone comes in the emergency room with a drug overdose such that their respiratory rate is 4. They look like this. Well, the nurse can feel pretty comfortable in saying that patient is hypoventilating. They're not moving air normally. On the other hand, someone can come in with a respiratory rate of 16, but if their chest isn't moving, if their tidal volume is very, very shallow, that patient's also hypoventilating. And of course, the consequence of hypoventilation, if you're not moving air, is the partial pressure of carbon dioxide is going to increase within your blood because you're not excreting it, you're not getting rid of it adequately. So that's how we determine, from a blood gas standpoint, that a person's hypoventilating. The CO2 in their blood begins to climb, okay, because they're not getting rid of the CO2 produced by tissues. Okay. So let's get back to the idea of pulmonary function test. So we have this patient breathe quietly, and then the person who performs this pulmonary function testing is a respiratory therapist typically. And the respiratory therapist is going to act like a coach. At some point, she's going to want to ask the patient to take a maximal breath in. So much so that he can't pull any more air in at all. So she's going to say, while he's breathing quietly, she's going to say, okay, now, take a deep breath. In. In other words, she's going to get him to keep pulling as much air as he possibly can pull in until he can't pull in any more. And you'll see this start to happen. Okay? And then he'll very transiently hold that breath. And then she may say, okay, push it out. And she'll keep yelling at him until he blows as much air as he possibly can out. And he can't blow anything more out. And then she'll say, okay, breathe normally. And so he goes back to quiet breathing. Okay, like this. Right? That volume of air that the patient inhales above and beyond tidal volume is called the inspiratory reserve volume. Okay. So in this chart here, it would be this red zone. Tidal volumes in white, inspiratory reserve volumes in red. That volume of air that's expired above and beyond tidal volume is called the expiratory reserve volume. Okay. And that's represented in blue. Okay. Now, if we add these three volumes, in other words, going from maximal inhalation to maximal exhalation, that volume of air is called the patient's vital capacity.
If you add the
If you
inspiratory
add reserve volume to tidal
the
volume to expiratory reserve
all
volume.
three.
If you add all three,
Okay.
okay, another way of saying that
So
is
the whole
that's the vital
entire height.
capacity.
Okay.
Okay. Now, notice that even after a patient's exhaled everything they can, look here. There's still some air left in the lungs that the patient can't access. That's called the residual volume. Okay, the residual volume. And if you add the residual volume to your vital capacity, okay, then that new total, vital capacity plus residual volume, is equal to total lung capacity. Notice that we have volumes here and capacities on this side. Capacities represent different volumes added together. For instance, vital capacity is your inspiratory reserve volume plus tidal volume plus expiratory reserve volume. Okay. Inspiratory capacity is inspiratory reserve volume plus the tidal volume. Functional residual capacity, expiratory reserve volume plus residual volume. So capacities represent a sum of one or more, of two or more volumes. Of course, you don't develop residual volume until you're born, until you take that first breath. Okay. Up until that point, there is no air in the lungs. After that point, there is always air in the lungs, even with expiration. I'll tell you a story you may have heard about. It was in the news. I think the lady's name was Stacy Peterson. This may have occurred, like, I'm just saying, it may be 5 or 10 years ago. That happened in California. there was this couple married in California. I think her name was Stacy Peterson, but I may be wrong about this, so if you know the right name, correct me. And she was married to a guy, I don't remember his name, let's call it Mark Peterson, okay? And you remember the story?
No, you just the way you said let's call him like your.
Yeah, because I don't remember his first name. And so they were married and she had become pregnant, okay? And this kind of thing, believe it or not, happens sometimes. And during the course of her pregnancy, he then fell in love with someone else. This happens in life, you know? This happens. And so much so that at some point he decided that he would rather be married to this other person as opposed to the pregnant lady, Stacy. Okay? And there's a couple of ways you can go about this. Okay? One is to get a divorce. Okay? The problem with a divorce is it can be very, very messy. Okay? It involves a lot of anxiety. It kind of disrupts your lifestyle. It can be very costly in terms of finances. But that's one way to go about it. Okay? That's one way to go, is get a divorce. He didn't opt for that method. Okay? What he opted instead was to try to get rid of Stacy, because that would be a lot quicker and less costly. He'd get away with it. So what he did was he told Stacy, let's do this. He had a boat. He said, I think they were going to California to San Francisco, further down. And he said, let's go on an outing. Let's go on a little trip.
I think this is a Lifetime movie.
Yeah, I was just
I
about to
was
say
saying
that.
that.
Oh, okay, I didn't even know they made it to a movie. But they went they went on a little outing.
Really similar.
It sounds like-
Which seems like a kind of a romantic idea. And at some point, when they were out at sea, he must have knocked her unconscious and put weights on her, okay, which then drug her down to the bottom of the ocean. The problem is that when you get down to the lower depths, the pressure increases such that if you're pregnant, it can actually lead to expulsion of the fetus. Okay? Sometimes. What's wrong?
Nothing. I just think that that's funny because I would never
Yeah.
think of that.
So,
Anyway.
so in any event, he goes on this trip with his wife Stacy, and he comes back alone. Okay? And then what does he do? He calls the police and says his wife is missing. In fact, he pulled an OJ. He offered a reward if they could find, the missing wife. If they could find what happened, or who was the culprit, because they thought she was kidnapped. Okay, but of course he knew exactly where she was. He was just pretending. You get this? Okay. That because he was actually the guy that threw her over.
Really?
Right. And the plan worked beautifully for a long time because the police were coming in and interviewing him. He looked distressed and all that, and but he had no clue as to where she was, and nobody could find her because she was down at the bottom of the ocean. And it worked wonderfully until a few months later, her body suddenly floats to the surface and comes to shore, and someone discovers it. And then sometime later, like a week later, another body comes to the surface. So that then they had to decide whether this was, under California law, a single homicide or a double homicide. You see, if you take the pregnant wife and you just kill her, you dump her overboard while she's pregnant, then that's really just a single homicide. He's not quite as bad a person as if the baby was born and then he dumps both of them. So the question is, how do you determine whether this was a single or a double homicide? Well, what the pathologist does is that he takes the fetus or the infant's lungs, and he dumps them in a kind of a bucket of water, if you will. Okay? Here's the lungs. And if those lungs float, it means the baby was already born. Why?
Because they would
Because they have
the
air.
residual.
And residual volume that brings them to the surface. On the other hand, if the baby had not yet been born, it was simply expelled from the pressure underneath the surface, then the lungs are going to go to the bottom, which is what happened. Okay? So it turns out he wasn't as bad a guy as you would think that maybe he could have been.
Really?
Well,
If you kill a pregnant woman in a car, it's a double vehicular homicide.
well, it depends on, this is just a legal issue. You know, and it varies apparently from state to state. Okay? So, but the funny thing is that then finally they caught up with this guy and put him in prison. Now, the girl that he was dating then had nothing to do with it, which I understand. Okay? Because you really, if someone's, you know, a murderer, you probably don't want to hang with that person.
So she didn't know his plan? Like, she didn't know that he actually killed her? She didn't think it was, like, a huge coincidence that...
I don't think she knew he was married.
Oh,
So he
okay.
was living a double life.
There we go. And that happens.
Right.
That happens. You know, love makes us do crazy things. What I don't understand, though, is that then he started having fans like they were talking about him getting married in prison. What is wrong with these people? Now, I'm not talking about him. Scott Peterson was his name.
Yes.
Not Mark. Scott Peterson.
Yeah.
Obviously, he's deranged. Obviously, he's got some issues. Scott's got some issues. But what about this lady who wants to marry him in prison? Like, what's up with that?
Well, she's also in prison too, so I mean, right?
Well,
No,
I know,
no.
but she didn't know anything about it. I don't think that's how the movie ended, though.
Well,
Like, I think she was dead, but I don't... Do you remember how the movie ended?
I didn't see the
No.
movie. I just read about it in the paper when this was
Well,
occurring.
Lifetime makes movies out of a lot of things that you would
Right.
never assume was made.
But this happens a lot. You have, like, I'll tell you, who was the guy, Manson, Charles Manson? I think he's gotten married now in prison. Like,
Yeah, he
who wants
has.
to marry a mass murderer?
Someone who wants to be famous.
And plus, they're in prison. Now, I understand you can have conjugal visits, but that's no way to live a life.
Wait, were they allowed that?
Huh?
Depends on
Yeah, they
where
do.
depends on where you're in prison.